Walking up the stairs should be a pretty simple task, but for people with COPD, it's not a simple task at all. Pulmonary rehabilitation programs can help people with lung disease reduce their shortness of breath and increase their muscle strength and endurance. Let's go to my office and we'll talk about it. Loss of the ability to do routine daily functional tasks due to shortness of breath is a common problem in people with COPD. The downward spiral is all too familiar. You first of all experience shortness of breath when trying to do more strenuous tasks like pushing a vacuum on a heavy carpet or mowing the lawn. The obvious response to that is to reduce the amount of time you spend doing that activity before you take a break or ask somebody else to do that same activity. Over time, even activities that require less exertion cause an increase in shortness of breath, and so you respond the same way. You take more time for rest breaks, or you have somebody else do that activity. And so the downward spiral continues. An increase in shortness of breath during activity results in inactivity, which results in a loss of muscle strength and endurance, and over time, you have extreme difficulty doing even the most simple tasks due to shortness of breath. The good news for people who have lung disease is that the loss of muscle strength and endurance is not directly related to the presence of lung disease. I like to say to my patients, your muscles don't have emphysema, your muscles don't have chronic bronchitis. You have lost muscle strength and endurance due to a reduction in physical activity that has resulted from shortness of breath when you do those activities. We can reverse that muscle weakness, we can reverse that loss of endurance through a supervised progressive exercise program while monitoring your oxygen saturation levels and your physiological responses to activity in a pulmonary rehabilitation program. Pulmonary rehabilitation at Atrium Physical Therapy consists of assessment of your functional capacity and physical limitations in our initial evaluation. We then move into progressive exercise, patient education, and training in breathing techniques. We talk about exercise principles and activities of daily living and energy conservation techniques as well. In the end, we make sure that you have a home exercise program established so that you can continue doing these activities when you finish with our program. Exercise increases your endurance and muscle strength. It promotes a higher level of function. It decreases your blood pressure. It counteracts depression. It promotes relaxation. It helps with blood sugar regulation and improves your performance of your daily activities and facilitates your sleep. Overall, exercise improves your wellness regardless of your health status. If you have shortness of breath due to lung disease, you might benefit from pulmonary rehabilitation at Atrium Physical Therapy. You might have COPD. One of the diseases in that category would include emphysema, chronic bronchitis, asthma, or bronchiectasis, or any combination of those. You might have pulmonary fibrosis, which is a restrictive lung disease, or a neuromuscular disorder that gives you difficulty with breathing, which would include something like multiple sclerosis or Parkinson's disease. If you have a need for pulmonary rehabilitation, you can talk to your doctor about getting an order for treatment at Atrium Physical Therapy, or if you're not certain whether you would benefit, please feel free to contact us for a free consultation. We can give you some advice about how to proceed after that point.